friend Dr. John Pro is going to talk about his history with testosterone pellets.
Hi, Denny. Good to be here. Yes, I began having a struggle with my weight and mental function and things like that in 2005. I was 42 years old, and during that time, I was searching for answers. I went and started testosterone creams. They tested my blood levels, and I was 130 out of the max I think is 1100 now. And the guy says, the doctor told me, he says, you are great for an 88-year-old. I said, well, I'm feeling like that. I'm feeling stiff, bloated, diet didn't work. So I tried to do the creams, and that was kind of ineffective. I struggled with that for several years to try to get it where it needed to be. And as a result, I opted to try doing pellets. And when I started doing the pellets, that turned everything around for me. I love the pellets because we put them in the beginning it was every 6 months, and when you needed it, if your body's physiology changed or you did something else and you needed it, then it was there for you. It wasn't a cream that you had to put on every day. The problem with the cream I had mainly was that it would, what they call aromatize. It would convert, and then it would basically convert to estrogen. They wanted to put me on a Arimidex, $130 a month to block the estrogen, and none of that stuff seemed effective. So I went with the pellets, and the pellets made an enormous difference. I was able to go on a healthier diet plan and proceeded to lose 21 pounds. And that process right there convinced me that this stuff is huge. Okay, so after doing the pellets for a while, it was suggested maybe we try doing injections, kind of rotate off of the pellets, because over time you develop, I don't know what they call receptor fatigue or adaptation to it or something like that, where you need the pellets more frequently. So instead of 6 months, 6.5 months, it goes to 5, 5.5, just depends. But the injections for me were difficult because the testosterone was in a oil base, and so you need a big needle. You had to get it down into the muscle. It just kind of was a pain for me. So that's why I prefer the pellets every 6 months to just using any other method.
Great. And you said you've been on the pellets since 2008?
Yes. Starting my 11th year now.
Great. Thank you for your time.
Well, then as a chiropractor, I work with lots and lots of people, and was aware of a lot of the physiology that's going on. And I noticed my own physiology changing pretty dramatically, and I didn't want that answer of, well, you're just getting older or fatter or whatever it is, But for me, the main thing that I noticed with my hormones when they're shifting is mental focus and acuity, the sharpness of thinking. The other thing, tolerance. When my hormones crash, like they get very low, I get intolerant. People would call it hypoglycemic or whatever all the other answers are. You get really emotional. I mean, it's effectively like you become so estrogen dominant that it is like PMS. Sleep a lot, crave a lot of sugar. I know now, after 10 years of doing this, when my level has to be replaced, and I'm searching for the right word. So I may look at a flower, might be, a marigold or something, and I'm looking, and I can't say the word. I can't remember a person's name. I'm explaining things to patients about their muscles, and I stumble over the word. I can't get the word out. This is a significant, indicator for me. And then people around me would say, yeah, you probably need to get checked. You're starting to get either whiny or you're getting emotional or you're intolerant or whatever those things are. So one friend of mine was asking about that one time, and he says, I used to go into a room of people for my business, and I was completely confident and in command of my my subject matter. And he says, today I go in there and I'm not sure. So self-doubt is another really powerful function that the testosterone, when you're taking it, really helps to overcome that. You become more centered, more confident, and those features alone help you do all the other stuff. A lot of people want to focus just on the physical aspect or sexual function or things like that, but there's several hundred different things that testosterone affects in the body, and for me, the most notable is this brain function issues.
Great, thank you.